Hello, my name is Megan McHenry. I'm a pediatrician and researcher here at IU, and I wanted to take a few minutes to talk about the opportunities that we have within our department for global health research and training. This gentleman in the photo, his name is Cleophas Cherub. He's a valued member of my research team based in Sampath, Kenya. And over 10 years ago, I was starting my pediatric residency as well here at IU, and I had very little research experience at that time or knowledge and what my future would hold. But during my training, I met some amazing mentors and linked up with researchers and staff like Cleophas in Kenya, and it really changed the trajectory of my career. So I wanted to, again, just share some of the opportunities that we have within our department with you. So to begin, IU and the Department of Pediatrics is a great place to do research. Our department is consistently in the top 5, if not the top 10, highest federally funded Department of Pediatrics based off of NIH funding for research. We have numerous NIH funded researchers across all the divisions, and most of the division heads are NIH funded researchers as well. We have 5 research centers within our department. We have the Wells Center, where most of our basic scientists are and their labs are placed. We have the Pediatric Translational Research Center, which again, it's the spectrum sort of translating basic science research to clinical medicine, and there is a special research clinical space that's reserved for them. Within our adolescent division, we have a large center for HPV research. And then PACER is a health services research division where it sort of cuts across different subspecialties in pediatrics to do health services and big data type of research. And then, of course, the Ryan White Center for Infectious Disease and Global Health, which is the division that I'm a part of and probably has our highest concentration of global health researchers, although we certainly have individuals doing global health research within each of these centers. I can't help myself since I am part of this division I wanted to highlight a few of the faculty that we have and some of the work that they're doing. We have Dr. Carlucci, who came to us from Vanderbilt and is developing a program to be able to follow mothers who are living with HIV and their infants in the postpartum period and the cascade of care and infant diagnosis of them. Dr. Inane has a K-23 through the NICHD, and she's looking at adolescent outcomes and cascade of care for them. She's also a TB researcher and has been on international committees advancing TB care as well as adolescent HIV care as well. Dr. Kaitan is a pediatric infectious disease doctor and also an immunologist, and so she's been studying the immunology in HIV-infected adolescents and children in Kenya. And then me, I'm Megan McHenry, and so my research program is focused on neurodevelopment in children living in Kenya, both those who are exposed to HIV and also malaria. We also have, in addition to our HIV core, we have a large malaria core as well within our division. And so we have some fantastic researchers. We have Dr. Conroy, who looks at the acute renal disease and kidney injury related to malaria infection. We have Dr. Dada, who looks at pediatric quality of life, as well as the tau protein and different neuro effects of malaria infection. Dr. Chandy John is the division head. He's an outstanding researcher, the former president of the American Society of Tropical Medicine and Hygiene, and his research program is around the neurodevelopmental effects of malaria infection. There's Dr. Schmidt, who is an amazing and brilliant basic science researcher who looks at gut microbiome and also does some preclinical studies related to that. And then Dr. Tuan Tran, who we share with the Department of Medicine and looks at immunology and both innate immunology and vaccine adapted immunology related to malaria infection. And again, we have researchers throughout different departments. They're looking at lots of different disease states and populations in global health as well. And so we do have a large Burmese community here in Indianapolis. And so we have individuals in the community doing research alongside of our Burmese community. We have a large oncology training program that's sort of based in Kenya. There's lots of research that comes out of that. We've had faculty that do emergency medicine in Nepal. There are both ICU doctors and cardiology doctors at Riley that do a lot of clinical work and also research in Lebanon. And then there are multiple global health type related projects if education is more of your interest in research, both based in Indiana and Kenya. And really I've been talking about Kenya a lot throughout this presentation, and because there are just multiple opportunities within our Sampath partnership. And so you'll hear more about this from Dr. Giles, but this partnership is over 30 years old. And while the mission is to lead with care, to ensure that all of the work that we're doing is actually improving the lives of individuals living in Kenya, research is also a component of that. And so the research that we do alongside our Kenyan colleagues covers a wider range of topics. So there's antimicrobial stewardship program and investigating community-based interventions, and the whole spectrum in between. Each of the research projects that we do in Kenya, we are partnered with Kenyan faculty and trainees to also help improve capacity building for the trainees, and also to ensure that the research that is recognized as being needed in those communities by Kenyan researchers and clinicians are getting to be able to be investigated and pursued. We have a formal pediatric research working group through Sampath, which helps provide support to trainees and young faculty doing research in this setting as well. And again, this is a sort of a different type of global health partnership when we're doing it in research. It's not something where someone from North America is dropping in, doing their project, and then leaving. All of the projects that we do on the ground, you have to be able to say like how it's going to directly improve care of individuals living with Kenya, and ensure that there is a Kenyan collaborator that you're working alongside to be able to think and create your ideas and be able to execute your projects. Another huge benefit to our global health program and research program at IU is the Morris Green Physician Scientist Development Program. So this program, it's not just for global health researchers, it's for anyone interested in research within our department. It identifies and supports pediatric residents and fellows who are interested in developing careers as researchers or scientists, or even just future academic leaders. And as part of this program, you receive mentorship with people who are both in your clinical area or the area of research that you're most interested in, as well as a member of the executive committee to help you with career development as well. We have monthly seminars that happen during the noon hour, and then twice a year we have a retreat, a spring and fall retreat, to be able to have more hands-on workshops and more in-depth career development activities. And then there's an annual stipend of $3,000 that you get per year whenever you're a Morris Green Scholar to be able to put towards research projects, towards international travel, or travel to conferences. And so when I was a resident at IU, I used my stipend to be able to travel to Kenya to be able to help out in different research projects and be able to learn the system there too. So it's a great program, and you feel free to email me if you have any other questions about that. Other training opportunities that we have within our department for those who are interested in long-term careers in global health are around the CTropMed certification that you can get. So CTropMed is the certification of knowledge in clinical tropical medicine and travelers health. So if you envision yourself becoming a clinician who is working primarily in international settings, this is a great certificate to get. It's through the American Society of Tropical Medicine and Hygiene. And so this is something that our program helps to support the infrastructure and the funding for interested trainees to be able to pursue. It's really for highly motivated residents that have an expressed interest in doing global health as part of their career, and they have to let us know pretty early on about this. The ones that we've had the most success with, or the ones who've been successfully completing the program, have mostly been fellows, and so that's certainly an option during your fellowship, but it's also very feasible for med peds residents and very, very motivated categorical pediatric residents. But if you're interested in having this as part of your residency program, it's something that you would need to discuss with one of our pediatric global health leaders. So that's myself or Dr. Polka Patel or Dr. Shana Hecht to get more information about how to set that up. But so that's all that we have for our long-term interest in research and training for global health. If you have any questions, here's my email address. And then again, in our YouTube channel in the About tab, there are email addresses for other faculty if you have any other questions. Thanks, and best of luck to you during this interview season.